We are going to see the effect of gravity in the blood pressure. Here is the heart at this level, atrium, ventricles. Here is the person, the thorax, the arms, the legs, and whatever in the legs, I don't know how to draw it. And here's the head. Alright, whatever. So here, this is the level of the heart. This pressure in comparison to the pressure like below the heart or above the heart, let's say this is pressure 0. This is, if we take some vein, let's say the cava vein, subclavia vein, whatever vein we have here, usually above the heart, we increase the negative pressure, because as we move down closer to the earth, we have increased action of the gravity, and so because the action of the gravity pulls things towards the center of the earth, pulls the blood all the way down. So if we are like this in supine position, nothing happens. But if we stand up, the blood goes to the feet. So here we have increased pressure compared to the heart, and here we have negative pressure compared to the heart. And so the veins that are above the heart can have a negative pressure that can collapse. If we have a negative pressure inside the blood vessel, it can collapse because the transmural pressure would be negative, and so we can collapse the artery or the vein. And this is important because if we are going to take a blood sample or to put a central line, we want to put the arm of the patient like in down position in order to prevent the negative pressure of the blood vessel, because if we have negative pressure and we insert the central line or whatever the needle that we are inserting, because we have negative pressure, the air can enter through these small small points that we are doing. So that small hole that we have is communicating the air and the vessel. So because we have negative pressure, the air can go, and so we can have an air embolism. So when we do some sample or some central line, let's put the arm of the patient at the level of the heart, and if we could, a little bit down. Other issue is that veins or arteries that lacerate that are above the heart, if we lacerate the vein, also we can have a air embolism, or if we lacerate the artery, we can have a air embolism. That if it is upwards the heart. If it is downward the heart, if it is below the heart, now here we have increased pressure. So for this, when we are passed from the lying position to the vertical position, the blood goes to the legs and stay there. So we have less blood in the circulation, and so we have less venous return. For that, when we stand up, we have less venous return, and the patient susceptible to change in volume could be patients taking alpha-1 antagonist receptor, alpha-1 adrenergic receptor antagonist by the first time. And if also they are taking thiazides that decrease the vascular volume, they are very susceptible to this changing in venous return, this decrease in venous return. So this is called orthostatic hypotension, that when we are lying down, passing to vertical position, we feel dizzy, and this is because we decreases the pressure, the pressure and the venous return coming to the heart, and because we have less blood pressure, this sympathetic pathway activates, and the sympathetic pathway is going to increase the heart rate, increase force of contraction, vasoconstriction, and so this is why when we pass from the lying position to the lying position to the vertical position, our heart rate increases. So first, we have a drop in venous return that can lead to orthostatic hypotension. and we have a compensatory increase in heart rate. So the effect of gravity pulls the blood to the legs, and this, in a sense, is similar to vasodilate the veins, because if we vasodilate the veins, there are more veins, more blood inside the veins, and so we have decreased venous return. So in just that sense, the effect of gravity is similar to that of the increase in the blood in the veins, that is vasodilating the veins. Alright, other issue is when we take the blood pressure, if the arm is above the heart, we are going to have a negative pressure compared, well, it could be negative pressure compared to the heart, for example, for a vein. In the artery, we would have less blood pressure than that of the heart. So we are fastly taking a decreased pressure. If we put the arm down, we will increase the pressure. So the ideal method to take the pressure is putting the arm at the level of the heart. If we up the arm, the pressure will be down. If we down the arm, the pressure will be up. But yes, we should take it at the level of the heart, because like that we will have a better estimating of the blood pressure. We are not fastly decreasing it or fastly elevating it. But this is not usually as we take it in the clinical practice. Not because we don't have the methods to do it, because I don't know why we don't do it, because it is comfortable to just put the arm of the patient in the table. But what we can do is put some books or boxes, something, in order to the arm achieve the level of the heart. But we normally don't do this. So all the pressure readings that are taken are done with the arm a little bit down. So the pressure actually that we take is above the truly pressure of the patient. But we cannot say, I mean, now that you're seeing the videos, you could say, alright, so I'm going to take the pressure, putting the arm at the level of the heart. But all the pressure readings are done like with the arm down, so increasing the blood pressure. And so because all the readings of the blood pressure are made like this, and all the articles publishing about how the pressure, the guidelines about hypertension and all that, are pressure readings taken from this position. So we need a comparison. So yes, even though this pressure is falsely elevated, we need our patient to put it now in this position, because if don't, we are not comparing the same way. We would have to take the pressure of all the patients, not here, and then compare it with our patient's pressure. But because we cannot do this, because all the pressure readings have been done like this, we need to put our patients like this. That is, we are not going to put boxes to the arm achieving the level of the heart, because we would just have a better estimating of the blood pressure, but that distortionates the pressure in comparison to the other pressure readings, because it would say, let's say here, I'd say 120, and here say 140, and so all the patients, we say in the guidelines, for example, hypertension is greater than 140, so give ACE inhibitors. So if the patient we would have taken like this, we would say 140. That is how all the pressure readings have been done. So we would give ACE inhibitor. But if we take it here until 120, we would not do it. So I think that this is a lot of trouble. But now we cannot do it, because we are not going to change. I mean, we should, but all the medical doctors take the pressure like this. So we need to take it like this, because all the studies have been